So here we're dealing with what sounds like just a activity-related patellar tendonitis. We're gonna get bolstered to start. Got you bolstered. You always want the knee bolstered. If I haven't mentioned that enough before, always do that. That towel. These can get pretty hot, so make sure you temperature check them before you apply. So, a minute. Here. Using that heat. Now, heat, especially with something like this, is ideal because it sounds like from like being in a static still position, activating. But the tendinitises tend to occur related to some kind of overuse activity, right? Driving certainly is one, but like, you know, whether it be a runner or anybody that does some kind of exercise, this is just a very common one that shows up. Now, my first thought process as I'm doing this, I'm going to use a couple, is to not be applying too much direct force. I think that's the thing to remember about these structures that are either tendons or ligaments, is we don't want to be crushing them. I want to be trying to kind of lift, get them, and bend them back and forth. That's my goal. Just get things as pliable as possible. And then with that, what's nice with using the heat, and it could be anything, like a weighted hot pack would be another nice option. Anything like that. It used to be what I would try to do when incorporating the weighted hot packs is I would set the lap pad, the weighted blanket, and the hot pack on the area, do the massage, and just let the weight and the heat do the work before I got to it. All right, so as I'm working, I'm just kind of trying to bend and pry everything away from my T-band. No, pressure. Okay. As I talk, definitely chirp up if I'm being too cruel. So I'm feeling, it's a little rough along that line of IT band. And as we work higher, people get scared and worried. And there's some bandiness there. Kind of felt that speed bump effect. That's where the massage is assessment. Like the client's just feeling me massage, but then I felt the muscle kind of roll over in a way that indicates, yep, stuff's tight. The nature of this symptom is making sense. So I'm not scared. It makes sense that this is just related to those hip flexors being tight. Now, for those new to draping, if you're working up closer to the hip, it can be worthwhile to go through the contour part of this, where rather than just doing the bunch between the legs, find the corner, scoop onto the knee real quick. Go ahead and act like you're asleep. You just scoop up under the knee, lasso that underneath the leg. Make sure you pull it high enough up to where like their hamstrings are sitting on it. Then you can bring that and you can drape a little bit higher. Working right on those hip flexors though, I usually have to go over the sheet. Nobody wants a wedgie. So to work directly on those, I tend to work on the quads and the stuff closer to the knee, here, draped. I'll get like a third of the upper leg undraped, and then the rest I'll do over the sheet. You may have to figure out a way to drape more accordingly if you were working with scar tissue, like doing cupping and the taping around the hip area. So, all right. Now, figuring out ways to help this, if I'm going to pick a direction of force, I'm going to be trying to pull those muscles. I'm assuming this is long. I need to approximate everything down. So I'm assuming this is long. I want to pull everything down back towards the knee. So from a myofascial standpoint, that's what I would be thinking. And I would try to direct most of those applications like that. If with a tendonitis, think about where the muscle belly is, where the tendon is, and try to push the muscle toward the tendon. And you're creating slack on that tendon. Now, muscle energy wise, what we can be doing is playing with that knee extension pattern. And pressure still okay? Okay. So what I would coach the client to do with this is not so much a kick where the foot comes off the table, but a straight, keep their foot in contact, but straighten their knee like they're pushing the back of their leg down into the bolster. Perfect. That replicates an action that more is about like fighting gravity, like standing up, rather than walking. So it makes those activate more to have them push the back of the knee into the bolster. So as I'm working, I'm going to ask, as we do these applications, I'm going to say, okay, go ahead and give me a little activation. Just hold it and slowly let go. Okay, little activation. And let go. And we could do a few more of those, like in other areas. Other ways to work here, like the ones I had talked about is like, if you're going this way, then you can come around and set yourself in such a way where, you know, keep your hand down so you don't have to worry about, you know, inadvertent contact or anything. My elbow is pointed towards the pelvis, but this would allow me to kind of work and pull those adductors away from the anterior group of the quadriceps. Now up at the hip joint itself, what I need to be doing is finding, and it gets easier and easier, I'm just finding the anterior superior iliac spine, find the forearm, and then I'm going to incorporate rotation and some knee stuff. Now moving kind of at fast speed, this isn't like quite as nuanced as like incorporating into a session, but if I wanted to start more lateral, usually it's easier for you to find that anterior superior iliac spine and go right inferior or below it. That'll be more on rectus femoris. So with that one, what I would ask is for you to activate the knee again. I'm trying to tell this muscle, relax, that works at the hip and the knee, again, that this portion of the hip needs to calm down when the knee is acting. Relax. Trying to say, like, I know you as one muscle work at both places, but the part of you that's about the hip doesn't have to be activating when it's at the knee, and I can feel it doing that. So again, you feel it kind of trying to kick on. Yep. Let go. And then one more. I actually feel like that's the big one. That felt like it got easier. Yeah. Good, let go. If you feel something change, confirm it with a client like that. Did that get easier? Did that feel a little bit better? If they say yes, then that validates what you felt, but you got their quickest like feedback related to like something changed, then move on to the next thing. Now I'm going to go a little bit more lateral because we identify that there's a lateral part of this that's more in play. So I want to make sure I get tensor fasciae lata as well. So usually I start here, more anterior, then I have to come a little bit posterior, sorry, a little bit lateral, more anterior, just come a little bit lateral. Same orientation with my forearm. And I get right on tensor fasciae lata, and now I know that tensor fasciae lata isn't just a hip flexor, it's also an internal hip rotator. So I can ask the client to turn their hip, so a whole leg, to the inside. Yep, there you go. Felt that. And slowly let go, come back to the outside. Okay, then rotate to the inside. Good, 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 good. And let go. And then again, rotate. That felt like it got easier?
Yeah.
And let go. Doesn't take a lot. Then here, still want that pliable, but already right now, that's moving substantially better. You do need to make contact with the area that's ouchy, right? So, okay, there's a little something there. Okay, a little activation of the knee. Yep, perfect. And slowly let go. My 2 cents with myofascial concepts is that take the tissue, take it to bind, have them activate the region. Almost doesn't matter how you have them activate it. Take the tissue to bind, pin it there, have them activate it. And then have them activate a couple directions and see what you feel like challenges what you're pushing on. Okay, go ahead and try to push your foot down on the table like you're flexing your knee. Like the opposite way. You're bending it like this.
Oh.
There you go, perfect. And let go. Okay, do that one again. Good. Then switch, flatten. Good. Okay, switch, other way, bend it. And let go. And flatten. Good. Let go. There. Felt it give just a little. And then we move on to the next part, which would be taping. So that would be the massage piece. What we're going to be doing here is a little bit of a reverse, not a reverse, but different than the picture on your form and the book, because that one shows taping inferior to the patella, which is the more common place for that tendonitis to occur. We're going to do the horizontal one up here. So now I have to trim this because it's just way too big to pull this off, right? Now the order of things, it's kind of, doesn't matter as much here. And I just have to round that edge out. Okay. Now we're going to tear an anchor. Tear an anchor. And then we're confirming that kind of this low, how high does it go? Let me keep on going. Oh yeah, you can go in point.
Right in here.
Okay, a little bit higher up. So tell me when I'm right there.
Yeah.
So I want to confirm that with the client, make sure that we're going to go right across that. You do not want to tape directly over top of the patella, because you're just going to press it right into the joint line. So, right?
A little bit lower.
A little bit lower. Okay. And here, go right. Now I want to, I almost did this wrong. Okay. Sorry. Now I want to set that aside, then stick it down too much. This is where having that contour drape is essential, because I'm going to have you bend your knee. Yep. There we go. So, skin on tension, right? Okay. Searching again.
Right there.
Okay. Then we want to go right across that. And real easy to just bring that anchor down at 0. Trying to just, there's nothing that will beat experience with being able to navigate laying the tape down and getting it to not roll over and crinkle on itself. You just got to mess with it enough to where that becomes natural. So now we got one there. Now the next ones are going to be where instead of one big U shape, or that goes from the lateral side of the knee down the lateral side of the upper leg and lateral side of the lower leg, we're going to do 2 on either side. So leave it bent. My suggestion with the knee stuff is to leave the knee just bent like this. That will usually do you fine. What you're just trying to avoid is if there's any kind of like fold here. Now, is your leg comfortable?
Yeah.
Okay. So we're going to come. I'm going to be going up. So I'm going to start my anchor. I'm going to find the fibular head. I know I want to be below that if I'm actually going to be affecting that bicep femoris tendon. But we're going to be going up and past that and up more, thinking IT band vastus lateralis. So here's it. Oh no, almost took my anchor. So here, come up, cross that line, and then I have to just steer that over. And ideally, if I had my way, I'd want this to, the middle of this tape to be on the line where IT band sits on top of vastus lateralis. I want it to be right there over top of that line. Okay. Then on the other side, here we can just have you roll your leg out. Not comfortable enough? Okay. Straighten a little bit more. I'm gonna pull the calf over. Okay. Now, same thing. There, there. Now for the pes anserine, the thing about that is it's actually over on the tibia. So you'd have to look at a chart to get a clear sense of what I'm talking about, but that comes over and it comes a little bit anterior. So I just know where that is, and you can always be looking at some kind of anatomical model to help guide you. I'm gonna make sure that anchor is below that. Crinkle. If you don't stick the tape, that's why you don't stick the tape down and immediately start rubbing, because if you want to be able to like pull it back and make some adjustments, that's where it's at. Now this is one option too. Roll the backing over itself, and then you have that handle rather than pre-tearing it. It's going to come up. Now the question always with the knee stuff, sorry, coming back off, adjusting a little bit, there we go. Is where it crosses that joint line at the knee, it does love to try to roll up. So it'll be, it's easy to test once I get this applied, whether or not that's the issue, whether or not that will be an issue. Now, typically, for if you revisit this in the video, it might be a bit more common to have this horizontal piece down here. But I now have these two pieces running vertically over top of those anchors. And it would be the same thing down here. And if we had to go further, if we had to make this tape do more shape changes, in this case we didn't have to as much. It created just an H shape over the knee. Then always remember, if it has a big swoop to it, just do two pieces or cut that piece of tape in half. I think this one will be all right.